thank the National Committee for the Preservation of Social Security and Medicare for giving me the opportunity to share some of my feelings with you about the future of Medicare. As Mr. Van Hollen mentioned, I'm a retired dentist, and since then I am director of a foundation. He told you what our mission was, and I think it's important to just mention now that in that position, if I didn't see it before, I know now what it is to help to care for senior citizens with poor economic status, and many of them with physical and cognitive disabilities. Of course, you don't have to be a senior citizen to avail yourself of what we're trying to do, but I see perhaps far too many of those. I want to apologize for reading a lot of this, a lot of my remarks, but it's in the interest of brevity. When I asked Reva, what should I speak about, she said about 5 minutes. When I became eligible to participate in the Medicare program, I was elated. From the history of my own parents, my wife's parents, and the parents of many of my friends, this elation was fueled by the expectations of being taken care of medically for the rest of my life. Now I have friends who are past my age, and like me and my wife, we're both 87. Of course, after that walk up that hill, I think I'm 97. And we spend many days visiting doctors and, unfortunately, a lot of funerals. Sure, we want to live longer. No one wants to be 100 except the person who's 99. The doctor's visits and visits to the pharmacy are getting more and more frequent, and believe me, we are getting nervous. Perhaps the cost of prescription drugs, even with Part D benefits, can put quite a crimp in one's budget. Now when I hear that there's a possibility that benefits will dry up, falling to what is commonly called the donut hole, and that we will be paying for more for medication, I really get nervous. I do not have I read about proposed voucher systems that will take care of that, put that in quotes, that will allow the elderly to take care of their pharmaceutical needs. But what happens when the vouchers are gone? Particularly if I hope to live as long as some of my friends who are older. Bob, who's here with me behind me, Abe, Norm, Evelyn, and many others, that really, really makes me nervous. And I hear that there's no need to worry. You'll be able to purchase health care insurance from insurance companies. No thanks. Been there, done that. Now I'm more nervous and concerned as ever. Now multiply all of my anxieties by the number of elderly who have less resources than do I, live out their lives, and have a chorus of folks who want to live and who ask that whoever is making out the rules, please help us to live a little longer and to live in decent health and be able to afford that health. You have medications, and this, Mr. Van Hollen mentioned my family. I do indeed have a beautiful family with 3 children, 8 grandchildren, 5 great-grandchildren, and this is what I would like to tell them at this time. You have medications you need to stay healthy, and they will be low cost, so you don't have to skip Medicare or cut in half to make it go further. That's if the proposals that this committee have put forth will be carried out. It is expected the donut hole, the one you would fall into when there is no more funds available for your drugs, will be eliminated by 2020. And I hope for your sake, I'm not sure I will be around, but you certainly will be, and hopefully you will not be as nervous as I am now. You will have free preventative services and wellness visits such as flu shots, mammograms, and no-cost screening for cancer, diabetes, and other chronic diseases. I hope you, my children and grandchildren, will not have to skip such services that would otherwise be difficult to afford, and of course, to pay the price later. Believe me, such programs offer services that will give many of us the opportunity to live out our lives more years than we ever would have envisioned. But years we could afford regardless of whatever bumps in the road go with advancing years. I thank my doctors who have insisted on such wellness visits and prescribed accordingly. One more thing I would like to say at the very end, and that is that I have a special prayer that I say to my children on behalf of one of our grandchildren, their sister, cousin, niece, daughter, Lauren, who will not be denied health care benefits without the change in the Medicare and the health benefit system because she underwent surgery at the age of 3 and prolonged treatment for a malignant brain tumor. And because she's reached a certain age and possibly will be denied benefits because of that pre-existing condition. And even if she did live that out, I mean, she is living to that time, thank goodness. But I think that I will not accept the solution that don't worry about it. You'll be able to have some vouchers to take care of it, or you'll buy insurance from a private company. And you can imagine what the cost of that would be. Besides all of the above, I further hope and pray that the Affordable Health Care Act will help my children and grandchildren during the years that precede their becoming seniors. Finally, when you consider what could lie ahead for you in healthcare as you live to an age that you never thought possible, that you will never be as nervous as I am.
Two of my mentors from Connecticut, members of the committee.
Good morning, Leader Pelosi, co-chairs of the committee, Representatives DeLauro and Miller, and members of the committee. Thank you so much for allowing me to speak to you today. My name is Cheryl Davis Darrow, and I'm here with my husband, Christopher. I would like to tell you a little about myself and what Medicare and Medicaid mean to me. I am a 54-year-old retired preschool teacher living in West Palm Beach, Florida. Medicare is very special to me. Many individuals have a family member or know of a person who relies on Social Security, Medicare, and Medicaid. My story begins 7 years ago when both of my parents became very ill at the same time. They needed extensive medical treatment and long-term care facilities to survive. I became their primary caregiver almost overnight while working a full-time job. I was totally overwhelmed. I did not know what to do or where to go for health care services. It turned out that Medicare and Medicaid provided a seamless flow of health care services when they were needed for both of my parents, and that was very important to me. This could not have happened with the Ryan voucher. I am not happy with the possibilities of losing my future Medicare. Why? Because to me, Medicare, along with Medicaid, is a success story. Medicare is doing what it was designed to do many years ago: provide guaranteed health benefits and your choice of providers. Everyone knows about vouchers, but you really wonder what they're really worth. A coupon comes to my mind. When you go to the store, you actually do not save much using them. The Ryan voucher brings to light that without Medicare, just what a major illness could do to me. That's even if I survive the Ryan voucher's cap on Medicare health care spending. I did not foresee the Ryan voucher when I made my retirement budget plans for the future. If I thought health care and retirement was going to cost my husband and me thousands of dollars more per year, I would need much more savings. But I, like many other hard-working individuals who were unable to save while raising their family, you have peace of mind when you know that you are participating in Social Security and Medicare. I took pride in my weekly paycheck deductions, and my coworkers felt the same way. I am not looking forward to a Ryan voucher at the age of 65 and having to wonder, what am I going to do when my limited voucher is not enough to pay for my health care services I need, or when it is not enough to pay for the plan that includes my doctors? Adding insult to injury is hearing the constant threat of appealing the Affordable Care Act, which will help people under the age of 65 obtain health care insurance before they become eligible for Medicare. This could easily have been me, trying to find affordable private health insurance if it were not for my husband's health care coverage on his job. The Ryan plan would also replace all of the health care preventative screenings and assistance with prescription drug costs that the health reform legislation provides. It sends cold chills down my spine. We are talking about the quality of life for our future generation. I'm looking forward to working with you, the National Committee to Preserve Social Security and Medicare, and others to ensure that Medicare will be here for my husband and me, my daughter, my granddaughters, and future generations. The bottom line is that Social Security, Medicare, and Medicaid is working. They are working to fulfill the needs of our aging population. Thank you.